Welcome to the launch of Investing in General Practice, March 2020, Opportunities to Improve Local Primary Healthcare. This briefing is intended to provide added depth to the Investing in General Practice prospectus and to further outline the opportunities open to general practices in the Murray PHN region. Murray PHN acknowledges the traditional owners of the land on which we work and live. We pay our respects to their elders past, present and emerging and extend that respect to all Aboriginal and Torres Strait Islander people. We recognise, celebrate and respect Aboriginal and Torres Strait Islander people as the first Australians. We acknowledge their unique cultural and spiritual relationships to the land and waters as we strive for equality and safety in healthcare. In 2019, Murray PHN launched its inaugural Investing in General Practice, which was a new way of commissioning services within general practice in our region to address chronic disease, after hours and mental health for our local communities. We were pleased with the response and participation from practices in this commissioning initiative. We received 71 proposals from across our region and commissioned 44 new projects. We are seeing the outcomes from this investment through better access to after-hour services, expanded service offerings and management of chronic disease conditions and improvement in low-intensity mental health services for children. Through our strategic plan, we work to build strong, effective partnerships with general practice and other providers in our communities. In 2020, we are continuing our support and investment in general practice. We are pleased to once again offer the opportunity for general practices to design and deliver projects locally to meet local needs. Our needs assessment recognises that our region is home to a range of vulnerable, underserviced, hard to reach or at-risk population groups. Many people are disadvantaged by economic circumstances, ethnicity, rurality or medical conditions. Furthermore, service system challenges and a decreasing GP workforce can cause acute delays in older adults moving into care and receiving the primary health care services that they need. We are encouraging new service design approaches to connect primary healthcare systems across communities, address the workforce issues that contribute to poor access to healthcare, and improve practice sustainability over time. This briefing is intended to accompany the Investing in General Practice prospectus for 2020. The prospectus is available on our website or in hard copy from your local PHN office. This year, the opportunities open to general practice are twofold. There are design and deliver opportunities in care coordination, after hours and mental health. As we read through the prospectus, design and deliver projects are highlighted in green boxes. These are for projects that are designed by general practice specific to the needs of local communities. Other opportunities are also available. These are projects that can be delivered by general practices based on an existing service model. These opportunities can be found throughout the prospectus in purple boxes. A key part of our commitment to general practices is our General Practice Support Program. Through this program, we can provide specific tools, resources and training, including Murray Health Pathways, e-referral, the GP data report and armchair medical. All of this is grounded by the work of our primary care consultants, who provide support to practices for quality improvement, business sustainability, workforce training and development, and also supporting practices through implementation of a funded project. I will now talk through the design and deliver project opportunities in turn. These are care coordination services for patients with chronic disease, access to after-hours services, and mental health services for hard-to-reach populations. Chronic and complex disease is growing more prevalent among underserviced populations within the Murray PHN region, with poorly managed chronic conditions often leading to unplanned hospitalisations. Complex or chronic health conditions can significantly impact on individuals and their communities, so it is vital to provide these people with high quality and coordinated care. We know that this can be achieved through improved management of patients within general practice. For design and deliver chronic disease care coordination projects, we will support models of chronic disease coordination that improve patient self-management, use multidisciplinary team care arrangements, and bolster practice efficiency. Model and design should address any complex and chronic disease conditions, focus on underserved populations, identify partnerships with the local service system, explore use of telehealth and technology, and use team-based multidisciplinary care. New models of care up to $100,000 per model will be evaluated. Sustainability funding of up to 20% of 2019 project funding is available to those practices who had a care coordination project funded through Investing in General Practice in 2019. The changing landscape of general practice is impacting working conditions for GPs in the after hours, making recruitment and retention of rural health workforce challenging. MBS changes and patient expectations are felt more strongly in rural areas. Limited availability or access to GPs in the after hours results in an increased burden on emergency departments and urgent care centres in rural and regional areas. Design and deliver access to after-hours services projects. We will support models that address local after-hours service gaps, including nursing workforce scope of practice, telehealth options and outreach. We are seeking models for underserviced and hard-to-reach populations, including rural and remote populations, aged care and palliative care. Collaborative partnerships with local service system and other general practices is encouraged. Also consider services within both sociable and unsociable after hours. New models of care up to $100,000 per model are available. Sustainability funding up to 20% of 2019 funding is available for after-hours services projects funded within Investing in General Practice in 2019. Murray PHN commissions primary mental health services across our region to support people with mental illness in their community based on a stepped care model. Stepped care is defined as an evidence-based, staged system within a hierarchy of interventions, from the least to the most intensive, matched to the individual's needs. The goal of stepped care is to ensure the right level of treatment is available to meet individual needs and at the time someone requires the treatment. Design and deliver mental health services in general practice projects. We will support place-based solutions led by general practice to meet local mental health needs. These need to be within a modified Monash model number 4 or 5 locations. Model design will need to include identification of the local underserviced population with unmet mental health need, clear positioning within the local stepped care framework, delivery of mental health support services, and strengthening partnerships with the local service system to provide patient pathways. It is important to note that models cannot duplicate existing funded services. Projects up to $50,000 per place-based model that addresses these needs will be available. I will now talk through the other opportunities available to general practices in turn. These are chronic disease management, remote patient monitoring, after-hours outreach services, telepsychiatry mentoring, support for patients to quit, stopping mental health stigma, building capacity to support people in suicidal distress, and building capacity to support people who are experiencing trauma. People experiencing homelessness often find it difficult to engage with primary healthcare services, even though they are living with a range of complex comorbid conditions. In Bendigo and Swan Hill, Haven Home Safe provides an outreach service to rough sleepers, offering case management, basic food and personal care items, and early intervention to reduce the psychosocial impact of rough sleeping. This opportunity is looking for general practices who would like to work with Haven Home Safe and accompany the service through the Hay Van in Bendigo or the Hay Ute in Swan Hill. The model will be a 3-hour fortnightly shift for a GP from 6 p.m. to 9 p.m. The funding on offer is $20,000 for one practice in Bendigo and one practice in Swan Hill to provide the GP outreach model. We know that some GPs want to build their capacity to manage mental health patients in an evidence-informed and recovery-oriented approach. In this opportunity, Murray PHN will fund access to secondary consultation services with psychiatrists for 10 practices. Those practices will receive packages of 50 telephone calls for point-of-care access to psychiatrists at the Melbourne Clinic. This trial is for 12 months. For people who have a mental illness, stigma is a real and significant problem. The actions and language of others can make people feel unwelcome and unsafe. This can stop them seeking the services they need, negatively impacting their health, well-being, employment, or social outcomes. In rural areas, there can be apprehension around help seeking and a fear of the stigma sometimes associated with mental illness, particularly in smaller communities where individuals are more visible and confidentiality is less assured. We will support general practices willing to adopt and implement the Stop Stigma Charter. The Charter aims to reduce mental illness stigma through a series of commitments. These commitments cover: we will be informed, we will listen, we will be mindful of our language, we will be inclusive, we will challenge the stereotypes, we will be supportive, we will promote recovery. We can provide a range of resources that have been specifically developed to support the Stop Stigma campaign and will work with practices to promote uptake and assist with implementation. Risk factors for cardiovascular disease are high in people with alcohol and drug and mental health conditions. General practices have a significant opportunity to address multiple risk behaviours of clients with mental health and substance abuse issues. This program is linked with the PIP-QI initiative, and it is aiming to help and improve clinical information systems for patient identification, recall and reminder, to identify the proportion of patients with a smoking or alcohol consumption status, and additionally to provide resources for patient self-management. In this opportunity, we will support 20 PIP-QI registered general practices to use data to identify patients who use tobacco or alcohol and provide them with support to quit. $16,000 per practice is available for a 0.2 FTE project worker or nurse for 12 months, and additional support and resources will be made available. We will support practices wanting to improve their capacity to support people in suicidal distress and also to help prevent suicide in their communities. Key areas of focus are expanding skills and resources to identify and care for patients who may be at risk of suicide, using clinician-supported online treatments within the stepped care model of mental health care, improving communication and coordination, particularly in a post-crisis environment, exploring the role of after-hours GP services in reducing mental health presentations to hospital emergency departments. When applying, practices should include the practice needs, such as training and development for GPs and nursing staff, communities of practice and other resourcing requirements. As part of this opportunity, Murray PHN will provide tailored solutions for general practice capacity building. The links between mental illness and trauma are well established. Childhood trauma, abuse, and catastrophic offence can lead to mental illness. Vicarious trauma may also be an issue for health professionals. In collaboration with the Blue Knot Foundation, Murray PHN will support general practices willing to improve their capacity to understand and support people experiencing trauma in their communities. We are seeking practices committed to improving their capacity to deliver trauma-informed practice. As part of this opportunity, We will offer funding, training and resources from the Blue Knot Foundation. Additionally, there will be workshops and communities of practice provided through Murray PHN. We know that remote patient monitoring can improve management of chronic disease and prevent potentially avoidable hospitalisations. Remote patient monitoring builds patient health literacy and understanding of their condition with clinical reassurance and guidance. We will provide a simple, smart digital health technology using the patient's own smartphone with other equipment provided to the general practice. We are looking for 10 general practices to establish and provide a remote patient monitoring solution for 10 patients with chronic disease. We are looking for practices that will embrace digital health technology, have an appetite for new service delivery models, have nursing capacity and readiness to participate. This service is for patients who have had an admission or emergency presentation in the past 12 months for their chronic condition, including COPD, diabetes or chronic heart failure, or additionally for patients at high risk of admission for their condition. Monitoring of data and alerts is not a real-time or after-hours service, but acts as a decision support tool by monitoring trend changes. This slide shows an indication of the type of technology and devices that are used within the remote patient monitoring service model. To participate in remote patient monitoring, patients will require their own smart device. This may be a phone or a tablet, iPad, or any other device that is available in the smart technology. This slide gives an indication of the type of platform that patients can expect to see through the remote patient monitoring model. Practices are also able to review patient data through the practice technology and platform. This slide gives an indication of what the platform can show to a GP or practice nurse who is monitoring a patient's information. Chronic disease management in general practice clusters. Australian rural communities experience a higher burden of chronic disease than regional and metropolitan areas. Rural communities generally have longer wait times for local health services, higher out-of-pocket expenses, increased distances to specialists, an unstable workforce, and higher rates of potentially avoidable hospitalisations. We know that integrated and coordinated models of care can improve health outcomes. In 2020, Murray PHN is working with local providers to strengthen an integrated approach to chronic disease management services across 6 cluster regions: Mildura, Loddon, Greater Bendigo, Shepparton, Wangaratta and Wodonga. For chronic disease management in general practice clusters, we will support one general practice in each cluster on the previous slide to improve and embed care coordination in general practices within the cluster to ultimately enhance continuity of care. Care coordinators will collaborate with the local service system to design sustainable service models that improve integration of care and patient experience. These models may include use and embedding of patient action plans, facilitated referral processes, expanded nursing scope of practice, digital health and telehealth supports, assistance for patients in health literacy and system navigation. Care coordinators will embed improvements within at least 4 additional general practices in the region. We can provide $80,000 in a 12-month contract for a 0.8 FTE care coordinator to be hosted by a general practice for each of the 6 clusters. Applicants must identify at least 4 local practices to partner with within the cluster region. The following slides detail the process for applying for investing in general practice in 2020. Registration for investing in general practice opens on Tuesday the 17th of March and can be accessed through our online tender search portal. You will need to ensure that you complete the pre-qualification questions, which will close on the 10th of April. In acknowledgement of the current COVID-19 situation, we have made the decision to extend the deadline for investing in general practice to the 1st of May 2020. We will continue to monitor the situation and extend the deadline further if required. Remember that there are two ways that you can participate in investing in general practice. Design and deliver projects for care coordination, after hours and mental health services. You can also apply for other opportunities. To apply through Tender Search, you will firstly need to register your practice. You will secondly need to complete the pre-qualification questions. You will then be able to download the required forms and templates to apply. For design and deliver projects, you will need to download the project plan and project budget templates. For other opportunities, you will need to download and complete the expression of interest form. Take some time to write and complete the application forms. Use the project plan and budget templates to design your model for design and deliver. Use the expression of interest template for other opportunities. If you have any questions during the application period, please ensure that these are asked via the Tender Search portal. Finally, you will need to submit all of your forms, project plans, budgets, and expressions of interest in one application via the Tender Search portal. Once again, the application deadline has been extended for the time being to the 1st of May. Once the application period has closed, all design and deliver project proposals will be evaluated by a panel of Murray PHN and external representatives. Projects will be evaluated against the following criteria: model design, practice readiness, understanding of the patient group, collaboration and link with the local service system, risks and challenges, measuring success, meeting local need, and value for money. This concludes the briefing for Investing in General Practice 2020. I encourage you to visit our website for further information and resources that will help you prepare a design and deliver project or apply for another opportunity. Also visit the Tender Search portal to register and download the forms and templates for investing in general practice. Finally, if you have any questions, please ask them via the Tender Search portal. We look forward to receiving and reading your projects. Thank you for listening.